You're going to want to put a towel roll proximal to the elbow. Okay? Now the landmarks, again, we're simply bisecting the segments. The humerus is going to be the proximal segment and the forearm is going to be the distal segment. We tend to do this motion in full supination. So we're going to be using the radial styloid process as a landmark for the forearm. I'm sure the notes say to use the lateral epicondyle as the axis, but again, and it's going to be the acromion on the upper arm. Again, just bisect the segments and let the axis fall where it may, okay? So, sorry, I need to maybe scoop my leg here, just if I need my goni. Are you going to fall off the table? Okay, good. That'd be not what I want to spend my Friday doing. All right. So you look like you're lacking a little bit of extension here. No, you're just chillaxing. There you go. So he is lacking 2 degrees of extension. For the flexion one, it's going to be really important that you measure extension. You can't measure flexion range of motion without measuring extension. Okay? So now we're going to have him flex. Now, of course, if I were, so he's right at 140. Way to be normal. Good. So I would test his end feel. Okay. I'm actually getting some resistance, so it doesn't feel like soft tissue to me for him. Okay, I'm going to have you relax your arm over here. But I said he was lacking 2 degrees of extension. Okay. So extension, bisect the 2 segments again. And Evan's carrying angle is 8 degrees. Now this is not a range of motion. We're simply stating what is the position of his forearm relative to his upper arm when he is fully supinated. Okay? So you're laying the goniometer right across the top of the arm and you're bisecting the segments. Okay? So we have elbow flexion and extension. Slide says 0 to 140. We'll stick with that, and all the way straight is 0 for those of you who can lucky enough to achieve it. The next ones we're going to do are forearm pronation and supination, and those are 0 to 80 each. Okay? So we're going to do active, just to make it simple on me. This one is a slightly odd goniometric placement. So I'm going to sit up nice and straight, and I'm going to have you bend your elbow to 90 so your hand's not on your lap. There you go, great. And I'm actually going to bring you up here just a bit. So I'm going to measure his supination first. To measure the supination, I'm going to put the goniometer on the inside of his arm. The vertical axis of the stationary arm, this is going to stay vertical. This is going to follow the path of his radius and ulna, and you're going to want to do it where there's the least amount of soft tissue. Okay, so pretty much distal wrist. So what I'm going to have you do is we're starting here, and if I have him in the starting position, both of my arms line up, right? So now I'm going to have you go ahead and go this way. And what I'm going to do is simply keep this vertical. I don't care at all about the axis. I'm putting this across, and he's got 0 to 85 or 84 degrees of supination. Okay? To measure pronation, it's going to be exactly the same, except now the goniometer is going to go on the outside. So now I have the goni on the outside. Go ahead and pronate for me. Good, and relax. And he has 0 to 87, 88. 0 to 88 of pronation on his left side actively. Okay? So again, we're using some geometry to make that work as far as axis and arms go, but the stationary arm is staying vertical. This arm is just lying across the wrist. You want to make sure you're not too far up the wrist because then you'll have too many soft tissues in the way. You want it to be right at the wrist. Okay? So those are the only 4 measurements we have. Oh, we've got carrying angle. Can you lie back down in the back? I need that for me. Carrying angle is a measurement of posture. I'm gonna have you scooch that way a bit for me. And maybe line the table with your